Thank you for choosing Vidant Health for your joint replacement needs. Our goal for you is to have a positive care experience and to get you as functional as possible for a safe transition to home. This video follows along and references the booklet, Your Guide for Total Joint Replacement. You should receive this handbook from your healthcare team. It is yours to keep. Use it for taking notes or writing down questions to ask when you meet with your team. Also, use the book to refer back to the exercises you should be doing before and after surgery. Being prepared will help your joint replacement surgery go more smoothly. In your booklet, you'll find this checklist of things you need to know. Also, write down your questions. Your healthcare team will answer any questions you may have when you meet with them. You may be nervous about getting a new knee or hip, but the better prepared you are before surgery, the easier your recovery program is likely to be. That's because preparing helps give you the strength and skills you'll need after surgery. It can also improve fitness, so start now. Your healthcare team will be there to help. Preparation can help make your recovery quicker and more comfortable. Now is the time to get these things done to make your recovery go more smoothly. Prepare your home before surgery. This will make it easier and safer to get around. Build muscles that support your knee or hip joint. This helps keep your new joint stable while you're healing. Strengthen your arms. This will make it easier to use walking aids after surgery. Learn how to protect your new joint. After surgery, you'll need to avoid certain movements. This can help your new joint heal. You will learn more about this after your surgery. Prepare your home to make it safer and more comfortable for your recovery. Ask a friend or family member to help you. Some specialized equipment you need may not be available until after surgery, but do as much as you can in advance. Here's some tips for getting ready. Stock up on toiletries, foods that are easy to prepare, and other items you'll need during recovery. Store foods and other supplies between waist and shoulder level. This makes it easier to reach things without straining your new joint. Arrange things so you don't have to use the stairs more than once a day. Keep your cell phone or portable home phone within easy reach. Arrange furniture so that you can get past with a walker. In getting the bathroom ready, ask your healthcare team whether you need any special equipment, such as an elevated toilet seat or a shower chair. Also, ask if you will need a handheld shower head and grab bars installed in the tub or shower. Get a rubber-backed bath mat to prevent slipping on a wet floor. Buy liquid soap and a long-handled sponge. These keep you from having to bend so much when showering. Special equipment may help you have a safer and easier recovery. If pre-op training is offered, try using the devices before surgery to become familiar with them and their use. Your handbook contains additional tips to help you prepare your home. Your home is the best place for you to recover after joint replacement surgery. Please take a few minutes to complete the checklist found in your booklet. The information will help you and your healthcare team develop the best plan for your recovery needs. Your healthcare team will be glad to help you with any questions you may have. These exercises do more than build strength. You'll also use them after surgery to help speed your recovery. Try to do each exercise at least 5 to 10 times. Do this routine twice a day. Ankle pumps will help prevent circulation problems such as blood clots. Practice ankle pumps by pointing and flexing your feet. Deep breathing exercises help prevent lung infections. Breathe slowly, taking the air deep into your lungs. Relax and breathe out slowly. Quadriceps sets. Lie on your back in bed, legs straight. Tighten the muscle at the front of the thigh as you press the back of your knee down toward the bed. Hold for 5 seconds. Then relax the leg. Abduction, adduction. Lie in bed with your feet slightly apart. Keeping your knee and foot pointing toward the ceiling, slowly slide your leg out to the side. Slide your leg back to its original position without crossing the midline of your body. Heel slides. Lie down or sit with your legs stretched out in front of you. Slide the heel toward your buttocks while keeping it on the bed. Placing a plastic bag or cookie sheet under the heel can help it slide more easily. Move it as far as you comfortably can. Hold for 5 seconds, then slide your heel back down. Gluteal sets. While lying on a bed, squeeze your buttocks together tightly. Your hips will rise slightly off the bed. Hold for 5 seconds, then release. These exercises build upper body strength. Your therapist or surgeon may advise you to use weights to make them more effective. You can use a can of soup or vegetables instead of weights. Biceps curls. Sit up straight. Keep your elbow close to your body and your wrist straight. Bend your arm, moving your hand up to your shoulder. Then slowly lower your arm. Triceps curls. Sit, leaning forward from the waist. Bend your elbow so your forearm is parallel to the floor. Then straighten your elbow as you extend your arm behind you. Seated press-ups. Sit in a sturdy chair with armrests. With your palms flat on the armrests, press down to lift your buttocks from the chair. Hold for 5 seconds. Bend your elbows to slowly ease back down. Your book contains more tips for exercising properly. After your total hip replacement, your new joint will have a limited range of motion. Now is the time to learn how to move to protect the new joint. Until your surgeon tells you otherwise, follow these tips and any others your healthcare providers give you. Always sit with your hips higher than your knees. Sit with both feet on the floor. Keep your knees about 6 inches apart. Don't let the knee on the operated leg cross the midline of your body. Don't bend over so your upper body is lower than your waist. Keep this in mind when standing and sitting. Don't turn your operated leg inward in a pigeon-toed stance. Keep this in mind when standing and lying down. For the anterior approach, you might be given certain precautions. For instance, you may be told to avoid stepping too far backward. You also may be told not to turn your foot outward. Your healthcare team will get you up and moving soon after surgery. Some of the first things you'll learn are how to sit and stand safely. Getting out of bed. Get out of bed on the side of your operated leg. Keep your thighs apart. Pivot on your hips using your arms to help. With your good leg, scoot to the edge of the bed. Sit on the edge of the bed with your operated leg slightly forward. With your hands behind your hips, push up to stand. Keep leaning slightly backward to avoid bending too far forward at your hip. Sitting down safely. Use a firm chair with a straight back, armrests, and a high seat. Back up until the back of your legs touch the chair. Reach back for the armrests. Keep your operated legs slightly out in front. Lower yourself slowly. Sit, then lean back in the chair. Keep your hips higher than your knees. To stand up, reverse these steps. Using the toilet. Back up until the back of your legs touch the commode. Place your operated leg in front of you, keeping your weight on the other leg. Reach back for the armrests. Lower yourself onto the front of the toilet, then scoot back. To get up, reverse these steps. Sitting up. The first few times you sit up, a healthcare provider will help you move your leg. Soon, you'll be able to sit by yourself at the edge of the bed with your feet flat on the floor. Be sure to speak up if you feel faint or dizzy. Standing with support. A healthcare provider will help you stand. A safety belt may be placed around your waist for the provider to grasp. This helps to prevent falls. Sleeping positions. Lie on your back while resting in bed. Keep a pillow between your thighs to prevent your knees from touching. You must have a pillow between your thighs if you lie on your side. To use your walker, you will need to learn a new way to walk. Here are a few basics to get you started. Remember, always follow any instructions given to you by your healthcare provider. After your total joint replacement, talk to your surgeon. With all surgical procedures, there are risks. You should review your concerns with your physician prior to surgery. Preventing deep vein thrombosis, DVT, and preventing infection are two primary areas of concern and should be discussed. Joint replacement is painful, and you will experience discomfort for weeks after your surgery. Your healthcare team wants to help you recover as quickly as possible. The key is to stay ahead of the pain. Tell your healthcare team when the pain starts and when the pain medication starts to wear off. By managing your pain, you are better able to perform your daily activities and therapies, helping you to recover faster. After surgery, you will be moved to your hospital room or your recovery room if your procedure was done at a surgery center. Your healthcare team members will monitor your progress after you wake from surgery. They will use support equipment to help you recover. Be sure to let them know how you feel and how well your pain is controlled. Special equipment may be used to help you heal. Not all patients will have all of this equipment, but it may include an IV line to provide needed fluids and medications, oxygen tubing, an incentive spirometer to prevent respiratory infections, a catheter to help drain your bladder, a drainage tube in your knee or hip to release excess fluid and reduce swelling, a sequential compression device to help prevent blood clots by gently squeezing, then releasing your foot and calf, a bedside commode or raised toilet seat to allow you to use the bathroom easily. After a hip replacement, you may also have a foam wedge or pillows placed between your legs to keep your new joint stable. In some cases, a brace is used. Physical therapists can help get you moving and back to your everyday life. They have experience examining, diagnosing, and treating conditions that limit the body's ability to move and function. Physical therapy sessions will include exercises to improve your strength and motion. Your physical therapist will also help you with practical movements such as getting out of bed and walking. Some joint surgeons will suggest working with occupational therapists after surgery. Occupational therapists teach skills that help you function in everyday life. Doing daily tasks correctly reduces pain and helps you heal faster. Your therapist may recommend you continue with the exercises you did before surgery. As you continue to recover, you will learn new exercises that will help you get stronger. Plan for discharge home 1 or 2 days after surgery in the hospital or the day after surgery in the surgery center. Follow all discharge instructions and be sure to consult the After Joint Replacement, A Guide to Your Recovery in your book to gauge how your recovery is going. Keep taking good care of your new joint. Return to activity slowly. A total joint replacement is major surgery, so don't be surprised if it takes a few months before you feel really good. Your healthcare team can help you make plans for your care after you leave. This care may include one of the recommendations listed here. Consult your handbook for more information. With pain under control, you'll get back to an active life sooner, so follow all your surgeon's instructions for managing pain. Be sure to tell your surgeon if your pain isn't controlled or if you suddenly feel worse. Medication, rest, ice, and elevating your leg can all help prevent and relieve pain. Pain medication often causes constipation. Drinking extra water and eating a diet high in fiber can help prevent this side effect. Being as active as you are able will help you keep a normal bowel routine as well. In addition to diet and activity, it may be recommended that you take a stool softener or laxative to help prevent constipation. Moving is a key part of your recovery. Taking daily walks and continuing your exercise program can help speed healing and make you feel better faster. A rehab plan and progress chart is included on page 36 of the workbook. You or your healthcare team can use this chart to keep track of your progress. Remember, your handbook has much more information and tips about your surgery and recovery. On page 35 of your book, you'll find a guide to your recovery chart. Use this zone tool to know how your recovery is going and when it's important to call your healthcare team. Plus, your team will have additional information for you depending on your particular needs. Thank you for trusting Vidant Health with your care. It is our mission to improve your health and well-being.